week on Lifeline TV. Paying it forward, what this new mom gave back to Salinas Valley Memorial Healthcare System's Neonatal Intensive Care Unit.
The nurses really were grateful, and that was a good feeling too.
Plus, treating varicose veins, the latest technology reducing both pain and recovery time.
They're able to get up and walk away, and then within a few days they're back to all their normal activities and work.
On this edition of Lifeline TV. Welcome to Lifeline TV. Salinas Valley Memorial Healthcare System is now home to a breast imaging center of excellence. The recognition from the American College of Radiology is well deserved in the eyes of cancer survivor Deborah Clefman. She experienced that high level of care firsthand during treatments at the Nancy Ausonio Mammography Center.
The care is wonderful. It's not only the facility, it's the personnel. I felt that I was always in really good care and with knowledgeable and friendly people.
We've achieved the American College of Radiology highest standards for our digital mammography services, stereotactic biopsy services, and ultrasound services. So this is the highest honor that we can receive.
I do feel like it's very much deserved, and I'm just really glad that on my cancer journey I was able to be here at this facility.
This is a voluntary distinction. It's above and beyond what we have already been accredited for, that is federally mandated through the Mammography Standards Act, MQSA. And so this is a great honor that we've been working hard to achieve.
It made a very difficult portion of my life just go so much more smoothly.
It's because we have such great staff here that we were able to get this distinction. This means that we have a state-of-the-art center with the best equipment available that's utilized in the best way possible. It means that all of our staff are trained to the highest level, and all of our physicians also meet higher standards.
I feel that they're very knowledgeable, and they all talk to each other and communicate with each other. And you have no idea how important that is, because when you're diagnosed, it is completely overwhelming. You never saw so many doctors, surgeons, labs in your entire life, and all of a sudden you have this list of physicians that you have to be in contact with. And it makes a big difference if they all communicate with each other. You feel like you're in a day spa. It's not this clinical cold setting at all. In fact, they even give you a blanket when you have your ultrasound and a little pillow to prop you up. It's tremendous to be able to feel that you're being supported and that there is genuine care and concern for your well-being and your comfort.
2013 marks an important milestone in Monterey County medical history. Salinas Valley Memorial Hospital opened its doors 60 years ago and has been dedicated to the health of the community ever since. The man you're about to meet played a special role in the unveiling of Salinas Valley Memorial Healthcare System. No one could have imagined the advancement in care and technology, but the hospital's name will always honor the country's war veterans. One glance through 96-year-old veteran Roy Diaz's living room is a glimpse into history.
I come out of prison camp, you know, and that was no picnic.
The sergeant is a survivor of the 1942 Bataan death march of World War II and has difficult memories that still feel fresh.
That's when freedom's gone. You don't have nothing to do. You couldn't say nothing. Just go out and work.
More than half of his unit didn't make it back home. It's why once he did, he became dedicated to honoring fellow veterans.
Yeah, just one shovel full of dirt and that was it.
It wasn't just any shovel of dirt. Back in 1950, a then 33-year-old Roy Diaz broke ground for Salinas Valley Memorial Hospital, a hospital built to save lives in memory of those who have served.
You wouldn't have ever thought of being a hospital there. You look around now, it's all big buildings and it's all medical.
It's really something because, you know, to think that, you know, he dug the first ground and then it started to grow, grow. And look what we have now. We have all this technology. Look at all these things that are happening. And people better start realizing what the Salinas Valley Memorial Hospital is doing. We have a great hospital.
Now it's home to robotic surgeries, innovative treatments, and a network of state-of-the-art comprehensive care. But Salinas Valley Memorial Healthcare System also has a permanent reminder of its foundation.
The plaque, the big plaque, they had it covered, and I had to go in and make a speech there and unveil the plaque. It was open.
The plaque has hung outside for 60 years, dedicating the hospital to veterans past
They were wonderful people that died.
and present, including the only Bataan Death March survivor left in Salinas, Roy Diaz.
It's really an honor for us to even be part of the hospital. And I hope the next 60 years will be even better.
Even though the newspaper has yellowed with time, the glow of Jo Scatini as a new mom still shines through.
Wednesday, April 22nd, 1953, from the Salinas, California. First baby at new hospital.
Jo gave birth to Catherine 60 years ago, shortly after Salinas Valley Memorial Hospital first opened its doors.
When I arrived at the hospital, there were ladies there from the night before. Well, I arrived at 5 and she was born at 8:30, so she was the first one.
In celebration, the first baby born at the new hospital was delivered for free.
Mom always said that I was the only one she got for free. The only free thing, actually, she ever got, right?
Oh, it was great, and I was treated like a queen. All the nurses were coming in and saying hi and congratulations, and I mean, it was just wonderful.
It wasn't just the nurses.
Baby articles. Total value of $5.
Wow.
Wow, they really
Went all out.
$5.
All of Salinas Valley sent congratulations for the birth of baby Catherine, but also the birth of a new hospital and legacy for the region.
As it was getting ready to open, everybody was in such a state of excitement because we didn't have nothing like what we got, you know. It was a big deal.
From the time I was very small, I just knew that that was my hospital. That's what I thought every time I passed it. Oh, that's my hospital.
Since day one, Salinas Valley Memorial Hospital has been a place of joy and comfort for the Scatini family.
Wow. You know, I had my 3 children at the hospital.
My 13 grandchildren were born at Memorial.
Just as the family has grown, so too has Salinas Valley Memorial Healthcare System.
And it's so big now. It wasn't so big way back when.
Oh my gosh, it's grown. Every time I go in there, it's beautiful.
I think it's amazing what they can do for cancer and heart conditions, and it's wonderful.
It's the progress of 6 decades, years of memories for Jo and Catherine from their very first portrait to now.
It was very special that, you know, to be here with my mom, and, you know, it's just like, there's the picture of us there, and now we're quite a bit older, but it's special. It's really special.
There are millions of people in the United States who have problems with the veins in their legs. Most likely, you know someone who's dealing with the discomfort of varicose veins. Amelia Zepeda Andrade discovered a 30-minute surgical solution at Salinas Valley Memorial Hospital's Wound Healing Center that got her back to work faster than she ever expected.
Chronic venous insufficiency, or problems with the blood flow in the veins of the leg, is very prominent in this country. And what it can lead to over time is varicose veins, which are the rope-like veins that can appear on the leg, which can cause symptoms. It's not just a cosmetic issue. They can cause symptoms such as pain, itching, burning, leg fatigue, leg cramps.
The first time that I went to the clinic, I had a problem where I had a hemorrhage on my vein.
How do we treat that problem? In the past, what we did was remove a vein surgically by as it says, stripping it or ripping it out from the leg, starting from the bottom of the leg and pulling it out. The problem with that operation is that, as it sounds, it's a little bit it's painful, and you're off work for a certain period of time. So with the advent of technology over the last 10 years and using a source of energy similar to the light bulb, we apply what's called radio frequency energy. Coming in from the side here. Todo, señora. ¿Cómo se siente? Bien.
I felt very comfortable with Dr. Johnny. He speaks a little bit of Spanish, and that gave me confidence that he would be taking care of my problem.
We inserted a catheter in her leg under just local anesthetic while she was wide awake in the wound healing center. And we advanced the catheter up to the groin area where the vein starts. And we're doing it with ultrasound so we can see where we are and stay out of trouble. And then we heat up the vein on the inside. But what we do to protect the skin and the patient is that we infiltrate around the vein with a fluid that cools the tissue around the vein, and it also is a numbing medication.
Don't be afraid that the surgery is going to hurt. The surgery is very simple. Everything was great, there was very little pain, and the recuperation is really fast and easy.
We encourage them to walk right after the surgery. There's less bruising because we only make one small incision rather than multiple incisions. They're able to get up and walk away, and then within a few days they're back to all their normal activities and work.
Salinas Valley Memorial Healthcare System has a commitment to its patients, which goes far beyond the operating rooms and hospital walls. Members of a dedicated palliative care team help families of patients facing difficult decisions. Rebecca Roberts and her life partner Joe found comfort in the emotional and medical support provided by Salinas Valley Memorial Healthcare System.
It was called Papa Joe.
For 18 years, Rebecca Roberts spent her days and nights caring for Papa Joe. He lost most of his motor skills after suffering a traumatic brain injury.
He always had a smile, no matter how bad things got. It was a labor of love. I loved him.
But after years of successfully battling health problems, Joe took a turn for the worse.
He was getting pretty sick, and I knew something wasn't right.
His kidneys and liver were failing. It was time to talk about end-of-life care.
Horrible to hear, but the way it was handled was, you know, the doctor, Dr. Katix, he came in, and I have told people that the way he talked to us is almost like I saw a halo around his head. He was wonderful, explained everything. He was kind about it. He didn't say, you have to do this, you have to do that. He said, what do you want? What do you need? What can we do for Joe? How do you want to do this?
Rebecca knew she wanted to bring Joe home to King City.
I didn't want him to be in a hospital room with, you know, things. I wanted him here with all his family and his music on the TV. And he's got, if you look in his room, 49ers and Giants and balloons and ribbons and pictures.
Dr. Katix and the palliative care team at Salinas Valley Memorial Healthcare System understood the importance of making Joe comfortable and getting him back to the comforts of home.
I rode with him in the ambulance and was able to just do bag ventilation on the way home. And when we got home, I was able to, you know, take the breathing tube out.
That was the number one most amazing thing, that he came with Joe like that. I mean, I love that guy. I hope if something ever happens to me, God forbid, that that's the face I see.
And I remember looking at his eyes, and he looked around and saw that he was home. And he was so frail and weak, but you could almost see his eyes were smiling.
You know, when you're in a hospital, only so many people can go in the room at a time, and this and that. We knew he was going to die. We brought him home. He had probably 20 people in that room standing there and giving him love and kisses and hugs when he took his last breath. I mean, he opened his eyes right before he passed away, and he looked at everybody. And he went like this, and looked at his mom, and looked at me, and he just went. Who is lucky enough to die like that? Not too many.
Even though the end of life is often very sad, it happens to all of us, and everybody has a right to pass with dignity when their time comes.
If a loved one went into cardiac arrest right now, could you help save them? The majority of you would feel helpless. 70% of the nation does not know how to perform CPR or is out of date on their training. But statistics show most lives saved with CPR are performed by a friend or family member. That's why Salinas Valley Memorial Healthcare System is committed to offering CPR classes to the community.
The service was ending and a gentleman was standing next to me. And just as we were ending the last part of the service, he just fell over completely. First thing I did was I got down and I checked his pulse, checked his neck, and he wasn't breathing. And I had reviewed CPR recently, and so I started that, and within about 2 minutes he was revived. And at that point, fire department and the medics came, and I turned it over to them.
Minutes can save a life, and so getting oxygen to the brain by circulating through chest compressions or CPR, that has shown case and case after case for decades that it can really make an impact in preventing brain damage, brain death, and obviously return people to full restoration.
Everyone should know how to do this. I think it's very important that you learn. I think if you can take a class, it'd be very important to do that. And you never know when something's going to happen. You know, you can be in a restaurant, you can be anywhere where an accident's at, and if you're trained, at least have some knowledge of it, you can probably save a life.
CPR classes are really easy. They're usually really fun. They're really short, and they're really tailored to the lay person. And you know, this is what's going to happen at your gym, or what if you come across this person at the supermarket. And again, just being able to be involved and not being afraid of any litigation by trying to take some of these valuable steps that are really simple can really make a worthwhile difference for that person that's been impacted by a sudden cardiac event.
One fireman that was there said I did a good job, so at that moment I saved his life. I felt really good about it.
Salinas Valley Memorial Healthcare System makes it easy to get the training you need to save a life. The $60 courses last 3 hours and are a combination of video and hands-on training. Certification also includes AED training. The certification is valid for 2 years. To check the class schedule and register, head to svmh.com/events. Many of the tiniest patients on the Central Coast are treated at SVMH. The Level 3 Neonatal Intensive Care Unit here isn't just designed for babies. It also focuses on the families of critically ill infants. That nurturing atmosphere inspired a new mom to pay it forward.
He's a little cowboy.
Baby Cody is full of life now, but Mom Lacey remembers all too well the worry she experienced the day he came into the world.
The doctor on call wanted us to go to the NICU and actually stay there for a while to observe his breathing, and they ran some tests. I had a lot of time to think about what it would be like. We were only there for hours, but what it would be like to be there for, days, weeks, months.
And so, when it came time to pay it forward,
my in-laws gave us some money in a card and said that the only requirement was to do something for somebody else and then tell them the story with the money.
Lacey was compelled to give back to the NICU at SVMH.
We sort of doubled it and added some more of our money, and then we went and bought fabric, and I made baby blankets.
Donated baby blankets don't just offer a sense of comfort in the NICU. Nurses say they are a useful tool.
We often use them to put under a sick baby, or as babies that are getting better, we use them to kind of cover and show parents how proper bed setting should be for when they go home.
The blankets also often become keepsakes for NICU families.
And they get to take them home when baby goes home, and usually the families come back and tell us, oh, the babies treasured them as they grew up.
It's the exact reaction Lacey hoped for as she stitched blankets for sick babies and their families.
It was fun to do that, and it was even more fun to deliver them and see how happy and surprised and the nurses really were grateful, and that was a good feeling too.
Hi, I'm Dr. Amy Lantis-Stemmerman. I'm the medical director here at the Nancy Osonia Mammography Center. I have some tips for you regarding mammography. We recommend yearly mammography starting at the age of 40, as the American Cancer Society recommends. This is important to find early breast cancers that can be treated and even cured. One of the things you can do to make a mammogram more comfortable is to use a mammography pad that helps make the test a little bit softer. When scheduling your mammogram, you should schedule it a week after your menstrual cycle. This way your breasts are less tender. And those are some tips regarding mammography.
Each year, the Salinas Valley Memorial Hospital Foundation hosts events to help fund important equipment and initiatives for Salinas Valley Memorial Healthcare System. Each event contributes to the overall mission of providing SVMH patients the best care possible. That includes the Men's Trail Ride, which takes place every spring.
Our fundraising events for the Hospital Foundation are really important because not only do they raise money, but they also raise a lot of friends. You know, we call them friend raisers sometimes because it's an opportunity for people to engage with something that the Foundation's doing, and if they didn't know about the work of the hospital or the Foundation, they come to the event, they have a good time, and then they get to learn more about us and hopefully become engaged in other ways. The Men's Trail Ride is celebrating their 24th anniversary this year. It's an opportunity for riders of really all abilities. We've got very experienced riders that go. We've got folks that get on a horse maybe that one time during the year to come to the trail ride. They do trail rides, they do some competition, they eat a lot of food, they play games like poker and things like that, and they just have a really good time. It's a great bonding event, you know, for the participants, and now what we're finding is that the participants are, the men that have been coming for many years are now starting to bring their sons. And it becomes a family affair, and it's very much a tradition of this foundation. I think our area, we're blessed to have that kind of culture here. You know, we've got a lot of folks who own horses and are into horse competition and things. It's an opportunity for them to get together and again have a lot of fun, but you don't have to be a rider. We've got some folks that go down there that enjoy hiking. You know, they bring some good books, they sit out in the afternoon in the sun, have some good food, and just have a great time.
The Trail Ride is just one of the Foundation's annual events. More information about each event is available at svmhfoundation.org. Your donations to Children's Miracle Network not only support care for children and infants, but they also support community programs that enrich the lives of young people. Uncovering the magic of music with each note. For 3 hours every night after school, dozens of 3rd to 7th graders from the Salinas Valley strum and sing their hearts out inside these rooms at the old Sherwood Hall.
Well, there's no word for it. It's just fantastic.
As the budget axe drops on schools throughout the state, sadly, music and the arts are among the first subjects that get cut.
They used to, but they shut it down. No more music at all. They even kicked out all our music teachers.
To me, it's the soul of a person, but also of a community. And I think in budget cut times, we think more of the nuts and bolts and forget that we really need to nourish the spirit. Otherwise, we're not going to flourish economically.
Getting better grades, being less lazy, listening more.
If kids don't have some way to express themselves artistically, then they're just missing a part of experience which is so crucial and so beneficial to them. So we see kids falling behind in their academic studies. We see them lacking the social cohesiveness that music and the other arts bring.
It's fun to see just your friends and just to learn all these songs that were made like a long time ago. It's just fun, makes my life happier.
And it's been a proven model for actually social change. So while we do provide music instruction, we consider ourselves really a social change program, and that through the inspiration, the discipline, and performance of ensemble classical music, we really transform the lives of our youth and our communities.
If you give your children the opportunity of have an instrument in their hands, you are giving them an opportunity in life, because that instrument in their hands might be their way out from temptations that they can find in the street.
We really are giving the youth a safe place to be for another 3 hours in the afternoon. And we've had parents tell us how much this is changing their children's lives. They're becoming more confident, better students, and some of them have said, it's keeping my kid out of a gang.
In addition to the training and weekly informal concerts at Sherwood Hall, the orchestra does perform at special events throughout the Central Coast. YoSal also has a junior program for kindergartners through second graders. In all, 150 kids take advantage of the program's services, and it doesn't cost the children a single dime, thanks to organizations like Children's Miracle Network.
Donations from organizations like Children's Miracle Network is really instrumental in getting us instruments for our children and for letting us run this program.
That's it for this edition of Lifeline TV. Thanks for joining us. For more on these stories or any information about Salinas Valley Memorial Healthcare System, log on to svmh.com. See you again next week on Lifeline TV.